Today's lecture is about physiological function of the growth hormone. Growth hormone, which is also called somatotropic hormone or somatotropin. Growth hormone definition. Growth hormone is a peptide hormone produced by the pituitary gland that stimulates development, growth, and regeneration. The growth hormone is produced by the anterior pituitary. It is made of 191 amino acids that make a long single chain polypeptide. It is synthesized in the somatotropic cell found in the anterior pituitary gland. These cells also store and release the hormone. Type of growth hormones. Growth hormones are of two types. Somatotropin growth hormones are otherwise referred by this name and is formed in the animal. Somatotropin. These are growth hormones that are in the synthetic form produced utilizing recombinant DNA technique from Escherichia coli. Regulation of growth hormone. The formation of growth hormone is regulated by the releasing hormone called somatocrinin along with inhibiting hormone called somatostatin, which is released by the neurosecretory nuclei of the hypothalamus. Hormones are secreted by the hypothalamus, nuclei of which are located in the hypothalamus. These regulating hormones are liberated in the hypothalamus portal blood that surmount the pituitary gland. The release of hormone in the pituitary is monitored by these two hormones that are affected by many external inhibitory factors. Somatotropic cell in the anterior pituitary gland. Synthesize and secrete growth hormone is growth hormone in a pulsatile manner in response to these stimuli by the hypothalamus. The largest peak occurs about an hour after onset of sleep with plasma level of 13 to 72 nanogram per milliliter. Maximal secretion of growth hormone may occur within minutes of the onset of slow wave sleep stage 3 and 4. Nearly 50% of growth hormone secretion occur during the third and fourth non-rapid eye movement sleep stage. Surge of secretion during the day occur at 3 to 5 hour interval. The plasma concentration of growth hormone, these peaks may range from 5 to 45 nanogram per milliliter. Between the peak basal growth hormone level are low, usually less than 5 nanogram per milliliter. Role of hypothalamus in production of growth hormone. The hypothalamus starts of this hormonal pathway by the releasing of growth hormone releasing hormone GHRH. When this hormone is released by the hypothalamus, it acts on the anterior pituitary to release growth hormone, factor which increase growth hormone secretion. Sleep increase the growth hormone secretion. Fasting, when a person is hungry, the growth hormone secretion increase. Stress, exercise, hypoglycemia increase the secretion of growth hormone. Dopamine increase the secretion of growth hormone. Increase amino acid, that is high protein meal, and reduce free fatty acid. When the free fatty acids are reduced in circulation, it causes increased release of growth hormone and glucagon, testosterone and estradiol. Growth hormone promote growth of many body tissue. It causes growth of almost all tissue of the body that are capable of growing. It promotes increased size of the cell and increased mitosis with development of greater number of cells and specific differentiation of certain type of cells such as bone growth cell and early muscle cells. Weight gain of a rat injected daily with growth hormone with that of a normal lighter mate. In this graph, this is the number of days and the vertical line show increase in body weight. Typical weight chart up to growing later met rats, one of which received daily injection of growth hormone and the other of which did not receive growth hormone. These are two rats. One was put on growth hormone daily injection and the other was put on normal diet. This graph shows marked enhancement of growth in the rat given growth hormone in the early day of life and even after the two rats reach adulthood. In the early stage of development, all organs of the treated rat increase proportionally in size. After adulthood was reached, most of the bone stopped lengthening, but many of the soft tissue continue to grow. So here you can see that the rat which receiving the growth hormone increase in size and both in size and weight. Metabolic effect of growth hormone. Growth hormone has multiple specific metabolic effects including increased rate of protein synthesis in most cells of the body, increased mobilization of fatty acid from adipose tissue, increased free fatty acid in the blood, and increased use of fatty acid for energy. Decreased rate of glucose utilization throughout the body. Thus, growth hormone enhance body protein use up fat store and conserve carbohydrate. Interaction between growth hormone and growth hormone receptor result in activation of intracellular protein genus kinase 2. Once phosphorylated genus kinase 2 activate the stat mean signal transducer and activator of transcription protein that is translocated to the nucleus and initiates transcription of gene in response to growth hormone. The state is able to bind to regulate the transcription of this gene. Thus, the presence of growth hormone can induce the synthesis of IGF-1 that occur mainly in the liver and is composed of 70 amino acids and has mitotic and anti-apoptotic effect. So here in this picture you can see that the growth hormone has a receptor on the cell surface which is called genus kinase or JAK receptor. When the growth hormone binds to it, it is activated by phosphorylation and other hormone which is present in the cytoplasm. When this JAK receptor is activated, it activates the protein state in the cytoplasm, and this activated signal transducer and activator of transcription a state protein then enter into the nucleus, bind to the DNA and cause transcription and produce IGF-1. IGF-1 is insulin-like growth factor 1. When this insulin growth like factor 1 is produced, it is then added to the blood and it acts on various organs in the body. The liver is a major target organ of growth hormone for this process and is the principal site of insulin-like growth factor production. Insulin-like growth factor production is a hormone that, along with growth hormone, help promote normal bone and tissue growth and development. IGF-1 has growth stimulating effect on a wide variety of tissue. Also has stimulatory effect on osteoblast and osteoclast activity to promote bone growth. In addition to increase height in children and adolescents, growth hormone has many other effects on the body. In the hypothalamus, signals arrive in the anterior pituitary. Anterior pituitary produce growth hormone. This growth hormone is then transported to the liver. In the liver, it produces IGF-1 and IGF-1 is then added to the blood and it acts on many organs in the body. In thymus, its function is hematopoiesis and increase in the immune cell. In the kidney, it causes glomerular development and function and integrity. It causes fetal growth and male and female differentiation cause growth of placenta. Ovaries cause follicogenesis, and in both cause normal bone growth, increase the testicular function and integrity, cardiovascular muscle development, and also cause protection of the heart muscle, and it is also a vasodilator. It causes muscle growth of the skeletal muscle growth and development, neural development, myelinization and protection, amyloid B clearance, and anti-inflammatory effects. So when this IGF is produced, it causes multiple action in the body on multiple organs. You can see that when it acts on the thyroid, produce T3, T4, and when act on thymus, produce immune cells and hematopoiesis, develop the muscles, the skeletal muscle and also the heart muscle, mobilize fat from the adipose tissue, increase secretion of insulin from the pancreas, and when act on the ovary, it causes differentiation and proliferation. Function of the growth hormone: increase calcium retention, which cause strengthness and increase the mineralization of the bone, increase muscle mass through sarcomere hypertrophy, promote lipolysis, increase protein synthesis, stimulates the growth of all internal organs excluding the brain, play a role in homeostasis, reduce liver uptake of glucose, promote gluconeogenesis in the liver, contribute to the maintenance and function of pancreatic islet, stimulate the immune system, increase deiodinization of and induce insulin resistance. Enhancement of amino acid transport through the cell membrane. Growth hormone directly enhances transport of most amino acids through the cell membrane to the interior of the cell. This increases the amino acid concentration in the cell and responsible for the increased protein synthesis. Enhancement of RNA translation to cause protein synthesis by the ribosome. Even when the amino acid concentration are not increased in the cell, growth hormone still increase RNA translation, causing protein to be synthesized in greater amount by the ribosome in the cytoplasm. Increase nuclear transcription of DNA to form RNA. Growth hormone stimulate the transcription of DNA in nucleus, causing the formation of increased quantity of RNA. This promote more protein synthesis and promote growth if sufficient energy, amino acid, vitamin, and other requirements for growth are available. Decrease catabolism of protein and amino acid. In addition to the increase in protein synthesis, there is a decrease in the breakdown of cell protein. A probable reason for this is that growth hormone also mobilizes large quantity of free fatty acid from the adipose tissue, and these are used to supply most of the energy for the body cell, thus acting as a potent protein sparer. Growth hormone enhance almost all facets of amino acid uptake and protein synthesis by cell, while at the same time reduce breakdown of protein. Growth hormone enhance fat utilization from the energy. Growth hormone cause the release of fatty acid from adipose tissue, increasing the concentration of fatty acid in the body fluid. Growth hormone enhance the conversion of fatty acid to acetyl coenzyme A utilization for energy. Therefore, under the influence of growth hormone, fat is used for energy in preference to the use of carbohydrate. Ketogenic effect of excess growth hormone. Fat mobilization from adipose tissue sometimes becomes so great that Large quantity of acetic acid are formed by the liver and released into the body fluid, thus causing ketosis. Excessive mobilization of fat from the adipose tissue also frequently causes a fatty liver. When fats are mobilized in large amount from the adipose tissue, it causes fatty liver. This is a normal liver and this is a fatty liver. It causes growth hormone decreases carbohydrate utilization. Growth hormone causes multiple effects that influence carbohydrate metabolism, including decreased glucose uptake in tissues such as skeletal muscle and fat, increased glucose production by the liver, and increased insulin secretion. Each of these changes result from growth hormone induced insulin resistance, which attenuate insulin action to stimulate the uptake of utilization of glucose in skeletal muscle and adipose tissue and to inhibit gluconeogenesis, glucose production by the liver. This leads to increased blood glucose concentration and a compensatory increase in insulin secretion. For these reasons, growth hormone effects are called diabetogenic, and excess secretion of growth hormone can produce metabolic disturbance similar to those found in patients with type 2 non-insulin dependent diabetes who are also resistant to metabolic effect of insulin. Growth hormone stimulate cartilage and bone growth. Its most obvious effect is to increase growth of the skeletal frame. This results from multiple effects of growth hormone on bone, including increased deposition of protein by the chondrocytic and osteogenic cells that cause bone growth, increased rate of reproduction of these cells, and a specific effect of converting chondrocyte into osteogenic cells, thus causing deposition of new bone. Abnormality of growth hormone secretion and hypopituitarism. This term means decreased secretion of all anterior pituitary hormones. The decrease in secretion may be congenital, present from birth, or it may occur suddenly or slowly at any time during life, most often resulting from a pituitary tumor that destroys the pituitary gland. Dwarfism. Dwarfism results from generalized deficiency of anterior pituitary secretion, panhypopituitarism, during childhood. In general, all the physical parts of the body develop in appropriate proportion to one another, but the rate of development is generally decreased. The body organ. A child who has reached the age of 10 years may have the bodily development of a child aged 4 to 5 years, and the same person at age 20 may have the bodily development of a child aged 7 to 10 years. Panhypopituitarism in the adult result from one of three common abnormalities, two types of tumorous conditions, craniopharyngiomas or chromophobe tumor may compress the pituitary gland until the functioning anterior pituitary cells are totally or almost destroyed. The third cause is thrombosis of the pituitary blood vessel. This abnormality occasionally occur when a new mother develops circulatory shock after the birth of a baby. In first pregnancy, when shock occurs in the mother, thrombosis of the pituitary vessel occur and this causes panhypopituitarism. The general effect of adult panhypopituitarism are cause hypothyroidism, depressed production of glucocorticoids by the adrenal gland, and suppressed secretion of gonadotropic hormones so that sexual function are lost. Thus, the picture is that of the lethargic person from lack of thyroid hormone who is gaining weight because of lack of fat mobilization by growth, adrenocortical and thyroid hormone, and has lost all sexual function except for the abnormal sexual pressure. The patient can usually be treated satisfactorily by administration of adrenocortical and thyroid hormone. Gigantism, the acidopalic growth hormone producing cell of the anterior pituitary gland become excessively active, and sometimes even acidophilic tumor occur in the gland. As a result, large quantity of growth hormone are produced. All body tissue grow rapidly, including the bone. If the condition occur before adolescence, before the epiphyses of the long bone have become fused with the short, height increases so that the person becomes a giant up to 8 feet tall. The giant ordinarily has hyperglycemia. And the beta cell of the isolate of Langerhans in pancreas are prone to degenerate because they become overactive due to hyperglycemia. Acromegaly, if an acidopalic tumor occurs after adolescence, that is, after the epiphyses of the long bone have fused with the short, the person cannot grow taller, but the bone can become thicker and the sharp tissue can continue to grow. This condition is known as acromegaly. Acromegaly enlargement is especially marked in the bone of the hand and feet bone and membranous bone, including the cranium and nose, bosses of the forehead, supraorbital ridge, lower jaw bone, and protrusion of the vertebrae because their growth does not cease at adolescence. Acromegaly, consequently, the lower jaw protrudes forward sometimes as much as half an inch. The forehead slant or slope forward because of excessive development of supraorbital ridge. The nose increased to as much as twice normal size. The feet require size 14 or large shoes, and the finger become extremely thickened so that the hand are almost twice normal size. Size of feet, and here you can see that the hand and the fingers are almost twice the size of normal hand. Change in the vertebrae ordinarily cause a hunchback, which is known clinically as kyphosis. Kyphosis is a hunchback, and this condition is clinically called kyphosis. Finally, many soft tissue organs such as the tongue, the liver, and especially the kidney become greatly enlarged. As usual, here are two MCQs. If your choice is A, that is the correct answer. And in question 2, if your select choice option E, that is the correct answer. So thank you. See you in the next lecture. Please subscribe the channel and write your valuable comments in the comment box for the improvement of the channel. So thank you once again.